So good morning, good evening, and good afternoon sa nagatanaw sa amuang presentation. Amua kay duha mi kabuk dire di lang maklaro kay video man. So ang amuang report for today is applications in the counseling settings. So I am joined by Miss Maika Pakibol and then yours truly. And today, what we will be learning about is several things. So first, we will define the key features of a structured personality test. We will explain the core assumption behind the first structured personality test, i.e. the Woodworth Personal Data Sheet. And then next, we will clarify the assumptions of the early structured personality tests using the logical content approach. Next, we will provide a brief interview of how the MMPI and the MMPI-2 were constructed. We will describe the specific K and F scales found in both the MMPI and the MMPI-2. We will highlight the strengths and the weaknesses of the MMPI and the MMPI-2. Kaya ating space ka baby, kaya maragduol na kayo sa camera ba, basig kuwan na kayo sa personal space. We will explain how factor analysis contributes to the development of structured personality tests. We will clarify the test construction approach used in the NEO personality inventory. So, Ms. Michael Labarejos will take the stage.
First topic is the major characteristics of structured personality test. Structured personality tests are standardized assessments that present clear and ambiguous statements for individuals to respond to, typically in a true or false or multiple choice format. So structured personality tests are objective, standardized, and easy to score because they rely on clear questions with predefined response options such as true or false or agree and disagree. These tests are designed to measure stable traits and individual differences objectively. Scoring is straightforward and often involves summing a responses marked in a certain direction. Unlike projective tests, example, the Rorschach inkblot test, which rely on an open-ended responses and interpretation. Structured tests are ensure consistency in administration and scoring. Example, the Minnesota Multifaceted Personality Inventory or the MMPI is a well-known structured personality test used in clinical setting to assess mental health conditions. A sample question might be, I often feel like people are watching me. Answerable by true or false. If the person responds true, and this aligns with the responses indicating paranoia, the test might flag possible psychotic tendency. Another structured personality tests are used in clinical psychology, job hiring, education, and personal development are the MMPI-2, 16PF or 16 Personality Factor Questionnaire, and the NEO Personality Inventory. This is an overview of strategies for structured personality test, the structure, deductive, and empirical strategy, which we'll be discussing on the next slide. So the deductive strategy, this uses logic and reasoning to create personality tests. There are two main types, the logical content strategy and the theoretical strategy. The logical content strategy approach uses common sense to create test items. For example, to test eating behavior, you'd ask about eating habits like, I often eat between meals. It assumes answers directly reflect a person's personality. Example, say I am outgoing means the person is outgoing. The test assumes answers directly reflect personality traits. In short, the questions are based on common sense. Second strategy is the theoretical strategy. This strategy is based on a specific psychological theory. Items are created to match the theory. For example, if the theory says there are 6 main personality traits, the test will include items for each of those traits. A test based on theory of 5 personality tests. Questions are created to measure specific traits like emotional stability or the empirical strategies. These use data and research to determine the meaning of test response. The two main types are criterion group strategy and factor analytic strategy. The criterion group strategy, this means uses groups of people with specific characteristics like being aggressive and compares the responses to a control group. Items that differ between the groups are used to measure those traits. In criterion group strategy, this compares responses from a group with a particular trait, example aggression, to a control group, and selects items that best distinguish the two. So if aggressive people often answer true to "I get angry easily" question, that item helps measure aggression. Second strategy in the empirical strategies is the factor analytic strategy. This uses statistical methods to group related items together. For example, if items about aggression and hostility are related, they may both reflect a larger trait like paranoid personality, or items about anger may be grouped to measure the broader anger trait. So in factor analytic strategy, uses statistical methods to group related items together, finding patterns in answers to measure larger trait.
Alright, so hello again guys, no? I will now be tackling the underlying assumptions of the Woodworth Personal Data Sheet. So, the Woodworth Personal Data Sheet, or the WPDS, is developed by Robert S. Woodworth. Now, during World War I, the Woodworth Personal Data Sheet is recognized as the first structured personality test. So, its underlying assumption was that individuals' self-reported responses could be taken at face value. So, that means na kung unsang gibutang nila dito sa ilahang mga test questionnaire, mo na yun to. Wala na underlying meaning. So, it directly reflects their psychological state. And the WTPS is employed as a logical content strategy, meaning that test items were selected based on their apparent relevance to emotional stability. So, for example, questions like, do you wet the bed at night? Were included to identify emotional maladjustment. And this approach relied on the belief that individuals would answer honestly, and that their responses provided an accurate assessment of their psychological well-being. However, this assumption did not account for response biases, such as deliberate misrepresentation or lack of self-awareness, if kung kailan silang sarili.
Now, let's proceed to the assumptions of early structured personality test, or the logical content strategy. So the first personality test ever developed is the Woodworth Personal Data Sheet. In early structured personality tests, such as the Woodworth Personal Data Sheet, were based on the logical content strategy, which assumed that people would understand test items and respond honestly, so people can accurately assess themselves. This means individuals understand their emotions, thoughts, and behaviors well enough to provide honest answers. Second is individuals are capable of accurately evaluating their own behavior, and people will be honest in their responses. This assumes test takers do not try to deceive or give socially desirable answers. The third bullet is the meaning of test responses will be clear and consistent across different individuals. If a question asks, do you often feel anxious? An answer of yes is assumed to indicate anxiety. The test items directly reflect personality traits. However, these assumptions were criticized for being too simplistic and leading to potential errors in personality assessment, like people might misinterpret questions or answer dishonesty. Responses can be influenced by social desirability bias or trying to appear better than they are, and questions may be too simplistic and not capture the complexity of personality. For example, if a person checks true or I never lie, the test assumes they are always truthful, but in reality, social desirability bias may influence the responses. This is another example of test based on the logical content approach. The two notable tests from the 1930s are the Bell Adjustment Inventory, measured how well a person was adjusting to different areas of life like home life, social life, and emotions. Example, a person's score might reflect how well they are coping with family issues or friends. In Bell-Reuter Personality Inventory, focus on traits like introversion, confidence, and sociability. Example, a young person might be assessed on how outgoing or shy they are in social situations. It was designed for people as young as 13. These tests were among the first to produce multiple scores rather than just one overall score, paving the way for modern tests that assess different aspects of personality. From 1950s is the Money Problem Checklist, which lists common problems like finances or relationships people face. If someone checks many items, it suggests they may be struggling with those issues. So, for example, if a person marks financial problems on the checklist, the test assumes they are having trouble managing money. In general, these tests rely on face validity, meaning that if someone selects a certain problem, it is assumed to be relevant to them.
Okay, so now let's tackle the criticisms of the logical content approach. So the logical content approach was useful for quickly gathering information. Wala na kamawa na about a person without an interview. Pero it had a weakness. So one issue is that it assumes people will honestly answer and fully understand the test items, which was not always the case. Okay, for example, a person might not be able to accurately assess their own behavior. So, for example, ako di ko makakuan ina, dili mo ko kay kung gainom og alcohol. Even though tinuod, gabi kay ko mag-inom. Dili ako. That was just an example. But or interpret the question the same way the creator intended, i.e. wet the bed. Okay, kasi kang nasa hunahuna sa tao ba nga gibasa lang nila ang ilang katre o tubig. Dili isa nangihi. So mo nang misrepresentation sa sa test answer. So these assumptions often led to errors, and the approach was criticized so much that it nearly disappeared. But eventually, a new testing method called the empirical afternoon group strategy replaced it. So now let's talk about the strategy they used in the construction of the MMPI and the MMPI-2. So, the Minnesota Multifaceted Personality Inventory MMPI. So the Minnesota Multifaceted Personality Inventory MMPI and its revised version, the Minnesota Multifaceted Personality Inventory 2, were developed using the empirical criterion strategy. So this approach involved selecting test items based on their ability to differentiate between the criterion group 1, typically individualistic with specific psychiatric diagnoses, and a control group of psychologically typical individuals. So unlike the test relied on face validity, the MMPI and the MMPI-2 determined the meaning of responses empirically. So it ensured that only items with demonstrated statistical differentiation between groups were included. So, the MMPI-2 improved upon the original by revising outdated items. So it expanded the normative sample and adding a new validity and content scales to enhance accuracy and applicability.
Now, let's proceed to the K and F scales on the MMPI and MMPI-2. The MMPI includes several validity scales to detect bias or consistent responses, which is the K and F scale. The K scale or defensive scale identifies individuals who attempt to present themselves in a highly favorable way by denying problems. High scores suggest defensive or attempt to appear well-adjusted. It measures whether a person is trying to appear healthier or better than they actually are. The high K score suggests the person is minimizing their issues, possibly due to denial or a desire to appear socially acceptable, meaning very defensive. The person denies problems and tries to seem perfect. Low K scores may indicate a lack of protection or excessive self-criticism, meaning overly self-critical. The person admits to more problems than they actually are. Example, a police officer, applicant, may try to hide anxiety symptoms by answering, "I never feel stressed at work." If they score too high on the K scale, raises suspicion that they are hiding their true feelings. Now, in the F scale, or the infrequency scale, detects individuals who try to fake bad by endorsing highly unusual or extreme items. High scores indicate consistent or exaggerated response that could invalidate the test. It detects unusual or extreme responses. An example of this is a person in court claiming severe PTSD might fake the symptoms by answering yes to unrealistic statements like, "I see demons chasing me every night." If their F score is high, it suggests exaggeration, and the psychologist will investigate further. A person in a legal case might exaggerate mental health symptoms to seek disability benefits or avoid responsibility for a crime. If they score high on the F scale, it suggests the response may not be genuine. The K and F scales on the MMPI help determine if someone is trying to manipulate their test results. And here is how the psychologists use these scales together. If K is high and F is low, the person is trying to appear too perfect or defensive. If the F is high and the K is low, the person is likely exaggerating problems like faking bad. If K and F are normal, the test results are likely honest and reliable. So these scales help psychologists determine whether the test results are trustworthy. This is the profile sheet of an MMPI and MMPI-2.
So since we just tackled on how they constructed the MMPI and the MMPI-2, let's discuss the strengths and weaknesses of it. So the MMPI and the MMPI-2 offered several strengths. They have a strong empirical foundation with items based on their ability to distinguish between clinical and non-clinical populations. So the inclusion of validity scales such as the lie or the L, or the defensiveness as the K, or the infrequency as the F, warning sign language scales help detect response biases, making the test resistant to intentional manipulation. So, their wide applicability extends to clinical counseling with thousands of studies validating their reliability and accuracy. So, supporting their continued use, the MMPI-2 improved upon the original test by updating the normative sample to be more representative of the general population. But it has its weaknesses. So, the high intercorrelation among scales can make interpretation complex. Malisod sabton. Okay, overlapping man siya. It has overlapping items to reduce the independence of scales. So the true or false response format is imbalanced and may influence responses, particularly in a case where individuals have difficulty choosing between two options. Additionally, the test requires at least an 8th grade literacy level. Kailangan ka makabasa aron na nga ma-answer niya man eh. Kay limit mo na sa una limitation kay that education was a golden standard and not many had access to it. So for those with lower literacy levels, the cultural and demographic factors must also be considered as interpretation. So it can be influenced by differences in age, gender, and ethnicity.
Using the factor analysis to build structured personality test. A factor analysis is a statistical technique that identifies patterns in responses by group-correlated test items into broader factors. This helps in creating tests that measure distinctive personality traits efficiently. Factor analysis is used to group related questions together to identify key personality traits. If multiple test questions about how social behavior correlate strongly, factor analysis might reveal that they are measured extraversion, leading to the development of an extraversion scale. So here's how it works. Step 1. Collect large data from many test takers. Example, 10,000 people answered 100 personality questions. Second is find questions that correlate. Example, people who say I love being around others also say I enjoy parties. These suggest both questions measure extraversion. Step 3 is identify underlying personality traits. If 10 different questions all correlate, factor analysis group them into one trait. For example, extroversion. And step 4 is remove unnecessary questions, because some questions might not fit any trait and get removed to make the test more accurate. In final result, a personality test with clear factors, like the big 5 personality traits were discovered using factor analysis instead of hundreds of random traits. Factor analysis found that most personality traits fit into these 5 categories, which is the ocean: or openness to experience, conscientiousness, extraversion, agreeableness, and neuroticism. The factor analysis improves test accuracy by reducing redundancy and ensuring that each test questions measures a real psychological trait. So it is useful because it makes tests more scientific and removing bias and unnecessary questions. Now let's proceed to the Woodworth Personal Preference Sketch for the EPPS and the ipsative scores. The EPPS is a structured personality test designed to measure individual motivational needs based on Murray's theory of needs. Instead of allowing responders to answer freely, it presents false choice items, reducing social desirability bias. So, the EPPS is a structured personality test designed to measure motivational needs such as achievement, affiliation, and dominance. The ipsative scores, instead of comparing individuals to a norm, ipsative scoring compares a person's traits against their other traits. This means that strengths in one area indicate relative weaknesses in another. Example, if a person scores high on achievement but low on affiliation, suggests that they prioritize success over social relationships. Here is how it works. The EPPS uses a first-choice format, meaning test takers must choose between two statements, even if neither perfectly fits. This prevents social desirability bias because test takers cannot simply pick positive answers. Example, a test taker may see, I prefer working alone or I enjoy leading a team. They must pick one, revealing their relative preference rather than an absolute trait. An ipsative scores is comparing traits within a person, unlike normative scores, which compare an individual to others. Ipsative scores compare a person against themselves. In the example, if a person scores high in achievement but low in affiliation, it does not mean they are bad at socializing. It just means they prioritize work over social relationships. These methods is used in career counseling to match people with jobs that fit their motivation. Another example is a person who scores a high achievement and low in affiliation might thrive in independent work environments such as research or entrepreneurship. Someone who scores high in affiliation and low in dominance may prefer supportive team roles rather than leadership positions. Here's a comparison of ipsative scores or EPPS versus normative scores in personality testing. The Edwards Personality Preference Schedule uses ipsative scoring, which is different from traditional personality test scoring. Ipsative scores, or EPPS, comparing you to yourself, which measures relative strengths. Example question, do I value achievement more than affiliation? So, if brain scores high in achievement and low in affiliation, this means he is more focused on personal success than social relationship. So it doesn't mean if he is bad at socializing, it's just that he prioritizes work over friendships. In normative scores, comparing you to others measures absolute scores A. Scores compare an individual to the general population. Example question, am I more extroverted than 80% of people? So if John scores high in extroversion, it means he is more outgoing than most people. Then in terms of choosing a career based on ipsative scores, a person who scores high in achievement but low in social affiliation is likely to enjoy independent careers like scientist, entrepreneur, or lawyer. And a person who scores high in affiliation and low in dominance might thrive as supportive team roles such as counselor, teachers, or nurse. So here is the final takeaways or thoughts. To summarize, the structured personality test plays a crucial role in psychology, clinical assessment, and career guidance. The logical content approach of every test evolved into empirical and factor analytic methods to improve accuracy. Tools like MMPI, EPPS, and Big 5 continue to refine our understanding of human personality. That will be all. Thank you for listening.
So si Ms. Labarreos gave her final takeaways. I will also give you mine, pero wala dre sa presentation. I'll say it by words. So, let's review. The Woodworth Personal Data Sheet, i.e. the very first na structured personality test. Next, we have the criticisms of the logical content approach, where people might misrepresent their data or misunderstand the test questionnaires. And next, we talked about the strengths and the weaknesses of the MMPI, the Minnesota Multifaceted Personality Inventory, and 2, their strengths and weaknesses. And I believe that was all I discussed. So, now that we're here, at the end, I thank you for your time, I thank you for your attention, and I hope to see you next time. Me and Ms. Labarejos bid you goodbye. Thank you.